So today I'm going to perform intramuscular injection. So this is for Mrs. Doe, who is due her intramuscular medication. This patient is in a community setting. All the equipment you need is provided. Please administer the medication using the prescription below. So this is the prescription. This is for Mrs. Jane Doe, address 22 Rose Cottage, December 24, 1943 as the date of birth. There are no known allergies, signed by a doctor today. The drug is hydroxycobalamin supplied as 1 mg per ml, batch number 2468. Dose is 1 mg, time is this time, once every 3 months, prescribed by a doctor today. This is a valid, complete, and legible prescription, and it is due now, so I'm happy to give this medication. Assuming that privacy and safety have been ensured, identity and allergy have been checked, pain and comfort have been addressed, procedure has been explained, and consent has been taken, I am now happy to prepare my materials. So first things first, I will begin with the 7 steps of hand hygiene. 1, 2, 3, 4, 5, 6, 7. Let my hands dry. Hold on. A visibly clean apron. I have here a tray that's already been cleaned with soap and water for the past 24 hours. I'm still happy to disinfect it. So let me just wear my gloves from a box that's dry, intact, and in date. I'll make use of this clinical wipes that's dry, intact, and in date. Clean this tray using an S motion from farthest to nearest, including the sides. As well as the bottom part. I'll let it dry. Just throw this in the clinical waste bin. I'll just retain this apron for the purpose of this exam. Now let me just prepare my materials. I need a syringe that's dry, intact, and in date. Withdrawing needle that's dry, intact, and expires 2024. Giving needle that is dry, intact, and in date. The gauze that's dry, intact, and in date. I need alcohol swab that's dry, intact, and in date. I also will need a sharps bin that's appropriately labeled and not 3/4 full. I also will need the medication. So the medication is hydroxycobalamin supplied as 1 mg per ml, batch number 2468. And there is no precipitate. I'm going to use this. Alright, I would need 2 pairs of gloves. From a box I've already checked a while ago. So I have my BNF readily available for reference. I will adhere to the 5 drug rights, and I will now be preparing the medication. So I'll make use of the alcohol swab. I'll throw this later in the clinical waste bin. I'll just clean the ampule for 30 seconds. Let it dry for 30 seconds. And then I'll throw this in the clinical waste bin. I just need a gauze to open it. Okay, throw this in the sharps bin. this in the clinical waste bin. I'll just set that aside. Open. Alright. Throw this in the clinical waste bin. Alright. So I will now be getting the desired amount. Okay. The desired amount is 1 ml per milligram. Okay. So using a one-hand scooping technique, recap the needle, take it out, throw this in the sharps bin. I will replace it with my giving needle. Throw that in the clinical waste bin. I will ensure that there will be no presence of bubbles. Okay. I now have the medication ready. I'll just throw everything else to the clinical waste bin. I'll make sure I'll throw this ampule in the sharps bin. And I now have my medication ready for me to go to the patient. So hi Jane, I'm back. I already have all the materials for me to administer your intramuscular injection. Are you still happy for me to proceed with that?
Yes.
Alright, so Jane, just before I do anything, I'd like to confirm that I'm still with the right patient. Can you tell me your full name and your date of birth, please?
Jane Doe, 24th of the 12th, 1943.
Alright, that's Jane Doe, December 24, 1943. That's correct. So how about your first line of address, please?
22 Rose Cottage.
Alright, I am definitely with the right patient. Do you have any allergies to food, medication, latex, or any dressing?
No.
Alright, I can see it's well documented in here and it's signed by a doctor today. So Jane, I'd like to inform you that I'll be giving you hydroxycobalamin. Have you had this before?
Yes, I think so. A couple of months ago.
Alright, yes, that's true. Actually, it's every 3 months. So you will be given this medication to correct any anemia. Alright, common side effect would really just be pain in the injection site. But if you feel anything else, don't hesitate to let me know, okay?
Alright.
Alright. So Jane, may I know, where have you had the injection before, if you can remember?
On my left arm.
On your left arm. Alright. Is it alright if we'll just use your right arm just to rotate the side?
Sure.
Okay. Alright. Is it alright if I just expose you a little bit?
Go ahead.
Okay, let me just expose you. And then let me just check the location, the site of injection. I can see that this would be a good site for injection, as there is no sign of inflammation or infection and there are no cannulas present, so this would be a good one. All right, so Jane, let me just explain to you how I will be going to give you the injection so you will be well aware. Okay,
all right.
So first things first, I will be cleaning the site for 30 seconds and then let it dry for 30 seconds. Then I would have to stretch your skin and you will feel a sharp scratch as I will be inserting the needle in a 90-degree angle, leaving 1 centimeter showing, and then I will aspirate for any presence of blood. If there's none, then I will be injecting the medication at a rate of 1 ml for 10 seconds. All right, and then I'll leave it for another 10 seconds just for optimum absorption. Okay, and then I will withdraw the needle, rapidly activate sharp guard, apply pressure, and then I will throw the sharps in the sharps bin, and then I will check if there would be any active bleeding. Is that clear?
Yes.
All right, cool. So first I will just locate the site. So just 2 finger breadths below the acromion process, I will create a V shape, and right in the middle, that would be our injection site, okay? All right, now first let me just clean the area using an alcohol swab. Throw that in the clinical waste bin. Alright. Clean for 30 seconds. Let it dry for 30 seconds. And then I'll prepare gauze. Alright. Are you ready, Jane?
Yes.
Alright, so again, just do your deep breathing and then you will feel a sharp scratch, okay?
Alright.
Okay, I will now stretch the skin, inject the needle, leave 1 centimeter showing, and then I will aspirate for presence of blood. There's none. So I will inject the medication now at a rate of 1 ml per 10 seconds. Okay, 7, 6, 5, 4, 3, 2, 1. Now I'll let it stay for another 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then I will abruptly withdraw and then activate sharp guard, apply pressure, and then I'll throw this in the sharps bin. Alright, making sure there's no massaging, and then I will check. I can see that there is no active bleeding, so I'll leave it as it is. I will not be applying any plaster. So let me just cover you back. So Jane, I've already delivered and given you your hydroxycobalamin. We'll check and see with the doctor if you will still need it after 3 months, alright?
Okay.
So, meanwhile, I'll just throw everything to the clinical waste bin. And all sharps and sharps component should be thrown in the sharps bin. The tray should be cleaned and ready for the next use. I will just document that I've already given you your medication. So I'll affix my signature, and then the date today, and then the time. Right. So Jane, I've already documented and you've already had your medication. I will stay with you for another 30 minutes just to check the efficacy of the medication or any side effects that may happen. Hopefully there won't be any. And assuming 30 minutes have gone past, Jane, is there anything else that you would need from me?
No.
No, all right. So don't worry because you have my number and you also have your GP's number. If in case you have questions or anything, feel free to contact us. But for emergency cases, always just dial 999, all right?
All right.
All right, Jane, is it all right if I just open the curtains?
Sure.
All right, let me just open the curtains and let me just end this station with 7 steps of hand hygiene. 7, and let my hands dry. Okay.